So trying to look at a concept which is known as uterine tenderness or subinvolution. Alright, uterine tenderness or subinvolution. Alright, so for the uterine tenderness and subinvolution, I'll just be looking at it. I just want to message my guy. So you just have to do it what? There are those conditions that often signal delayed or abnormal recovery of the uterus after childbirth. So while they can occur independently, they frequently overlap. That's why I'm even discussing them together. Okay, so they can occur independently, they frequently overlap, especially when infections or retained placenta tissue is involved. Okay, so what is subinvolution? We'll look at subinvolution, is when the uterus fails to shrink back to its previous pre-pregnancy size, within the expected time frame. That's after a woman gives birth, the uterus should shrink back, to the normal small size it used to be. So instead of gradually descending and framing up, the uterus remain enlarged, soft or boggy. So causes could be prolonged or heavy bleeding, pelvic pain or discomfort, foul smelling lochia, uterine tenderness, especially if infection is present. So common causes is maybe retained placental fragments, postpartum infections or endometritis, uterine over distension. Maybe you have had cesarean section or uterine surgeries, uterine fibroids. So symptoms to watch out for is persistent uterine tenderness, enlarged uterus and palpations. The woman is having prolonged bleedings and heavy menstruation, fever, chills or foul smelling discharge, backache or pelvic pressure. So diagnosis and management is physical examination, fundal height checks, ultrasound to dictate retained tissues or clots, blood tests for infections or anemia. So treatment may include uterotonics, antibiotics for infections, dilation and curettage if tissues remain, then uterine massage and breastfeeding. So if the woman starts breastfeeding, the hormonal change can stimulate contractions in the uterus.